recognize Ms. Maureen Rosette, a board member of the National Council on Urban Indian Health. Ms. Rosette.
Good morning. My name is Maureen Rosette, and I am a citizen of the Chippewa Cree Nation and serve as a board member for NCUIH, National Council of Urban Indian Health, which represents the 41 urban Indian healthcare organizations across the nation who provide high-quality, culturally competent care to urban Indians, constituting over 70% of all American Indians, Alaska Natives. I'm also the Chief Operating Officer at the Native Project, an urban Indian organization located in Spokane, Washington. Let me start by saying thank you to Chairwoman Porter, Ranking Member Moore, and members of the subcommittee to share how the opioid crisis is plaguing our Native communities and to request inclusion of urban Indian organizations referred to as UIOs in the critical opioid response funding. The codified declaration of National Indian Health Policy states that it is the policy of this nation in fulfillment of its trust responsibilities and legal obligations to Indians to ensure the highest possible health status for Indians and urban Indians to provide all resources necessary to effect that policy. In fulfillment of this policy, the Indian Health Service funds 3 health programs to provide healthcare to Native people: IHS sites, tribal sites, and urban Indian organizations, referred to as the ITU system. Unfortunately, the system has been hampered by decades of chronic underfunding. Additionally, while the majority of the Native population resides in urban areas, only 1% of the entire Indian health budget is provided for urban Indian health. Our UIO, the Native Project, provides medical, dental, behavioral health, pharmacy, care coordination, wellness, and prevention services. Our patients include Native people from over 300 different tribes. This year, we've had virtual wellness nights with activities like powwow, dancing, painting, regalia making, planting, and cooking, where we bring to life the meaning behind culture is medicine. Along with the 40 other UIOs, we play a critical role in addressing the opioid crisis impacting Native communities. A review of one UIO records from 2018 to 2021 showed that over 80% of clients that engage in behavioral health services had co-occurring mental health and substance abuse disorders. Opioid disorder was the most common substance abuse diagnosis. However, as we will illustrate today, UIOs are cut off from critical funding resources designed to help Native communities, negatively impacting the health outcomes for urban Indians. Additionally, the opioid crisis and the COVID-19 pandemic are intersecting with each other and presenting unprecedented challenges for Native families and communities. A study found that 1 out of every 168 Native children experienced orphanhood or death of caregivers due to the pandemic. Native children were 4 times more likely than white children to lose a parent or grandparent caregiver. This has exacerbated mental health and substance use issues among our youth. During the last government shutdown, one UIO suffered 12 opioid overdoses, 10 of which were fatal. This represents 10 relatives who are no longer part of our community. These are mothers, fathers, uncles, and aunties no longer present in the lives of our families. These are tribal relatives unable to pass along the cultural traditions that make us as Native people who we are. To address the opioid overdose epidemic in Indian country, Congress has provided funding for tribal opioid response grants. We have long advocated for UIOs to be added to these grants, given the extent of the impact of the opioid epidemic on all American Indians and Alaska Natives, regardless of residence. However, the final language in the omnibus removed UIOs as eligible, so UIOs like mine working against the same problem are again left without the resources. This is a failure of equity and the trust responsibility. Therefore, I want to emphasize the importance of explicitly mentioning urban Indian organizations in legislation to ensure funding designed to reach Native communities actually does. As one advocate stated, the language everywhere has to include the word urban. They have to say it, they have to write it, and then it will reach a critical mass eventually, because they don't get it, we're just invisible. In conclusion, more needs to be done to address the opioid crisis, ensure that all Natives have access to life-saving health care. I urge Congress to take this obligation seriously and provide UIOs with all the resources necessary to protect the lives of the entirety of the Native population, regardless of where they live. Thank you for the opportunity to speak today. I provided written testimony to the committee and I'm happy to answer any questions. Thank you.
Thank you, Ms. Rosette, for your testimony. The chair now